Today's class is on shock. This is the last topic in the hemodynamic disorders or circulatory disturbances. And by definition, shock is a condition in which the vital functions of body are depressed due to severe acute reduction in the cardiac output and effective circulating blood volume. So, whenever there is acute reduction in the cardiac output, there will be effective reduction in the circulatory volume. So there is progressive cardiovascular collapse when the cardiac output and effective circulating volume is diminished. There will be cardiovascular collapse, which is characterized by hypotension, that is low BP, hyperventilation, clouding of consciousness, and oliguria. So these are the classical signs of shock. So whenever there is hypotension, hyperventilation, clouding of consciousness, and oliguria, that is decreased urine output, you must think about shock. Types of shock: because of the cardiac causes, cardiogenic shock, then hypovolemic shock, that is a second category, which is due to excessive fluid loss or blood loss, as in trauma or dehydration because of some diarrheal diseases. Then a septic shock because of infections, neurogenic shock, and anaphylactic shock. These are the 5 different types of shock. Causes of cardiogenic shock include cardiac diseases like myocardial infarction, cardiac arrhythmias, cardiac tamponade, and massive pulmonary embolism. Hypovolemic shock is due to lack of blood volume or effective blood volume because of loss of blood in trauma or severe bleeding, or due to fluid loss as in vomiting, diarrhea, and diseases like cholera, and severe burns. Septic shock, previous name was endotoxic shock, and this is secondary to septicemia because of gram-negative infections, gram-positive infections, or fungal infections. Neurogenic shock because of anesthetic drugs or spinal cord injury. Anaphylactic shock mainly due to allergic substances. It's a type 1 hypersensitivity reaction. So pathogenesis of the shock differs, but in general, because of decreased circulating blood volume, decreased venous return to the heart, again it causes decreased cardiac output, decreased blood flow, and because of the decreased blood flow, there will be decreased supply of oxygen to the tissues that result in tissue hypoxia or anoxia. Inflammatory mediators are released and they are the cause for the shock. Coming to the stages of the shock, shock is a progressive disorder which is if uncorrected, that leads to death. So 3 phases include non-progressive, progressive, or irreversible phases. Non-progressive phase. In this phase, the compensatory mechanisms are activated in our body and perfusion of the vital organs is maintained. In progressive stage, it is characterized by tissue hypoperfusion, worsening of the circulatory and metabolic imbalances. An irreversible stage, cellular and tissue injury is so severe that even if the hemodynamic defects are corrected, survival of the individual is not possible. So they are the 3 stages, and the morphological changes in various organs, mainly the vital organs like brain, heart, lung, and liver, kidney, etc. are affected. Brain suffers from hypoxic injury. Because of hypoxia, the changes in the brain are known as ischemic encephalopathy. There will be focal necrosis and swelling of the neurons. In the heart, there will be subendocardial hemorrhages, coagulative necrosis of the myocardium. So in all the organs, there will be tissue death or cell death in the form of necrosis. So in brain, there is focal necrosis. In heart, there is coagulative necrosis of the myocardium. Then lung, diffuse alveolar damages and ARDS. In liver, there will be central hemorrhagic necrosis or fatty change in liver. Kidneys, acute tubular necrosis. In adrenals, there will be lipid depletion. In GIT, hemorrhagic encephalopathy or patchy necrosis. An outcome of shock, it can be recovery if it is treated early. In the non-progressive phase itself, there is chance of recovery. Then the patient may survive with permanent changes in various organs. And if not treated, death is the